So today's program is entitled Making the Most Out of Medicare's Open Enrollment. So today, and thank you so much for the colleagues that are here who are assisting in person. It's greatly appreciated. I do want to give a shout out to our team. We have Yordi, who's on our team. Raise your hand, Yordi, for the folks in the room. We have Charlie and David, who's also on the VICAP team, and then our wonderful partners, Nick and Jennifer at PRCR, who are assisting and have graciously provided us with this space. We couldn't do it without our colleagues, so thank you so much. So let's talk about what's on the agenda for today. We're going to give an introduction to VICAP, talk about the Medicare basics, and then also give a demo of how to use the Medicare Planfinder. So VICAP, again, is part of a part of a national network. The State Health Insurance and Assistance Program is across the United States of America to include Puerto Rico and Guam and the Virgin Islands. There is a program that's housed, again, across the state. So VICAP is in the state of Virginia, and we have our partners across each jurisdiction. So there's a VICAP program in Loudoun County, Alexandria, and so on and so forth. So we are serving Arlington County residents. So if you're here and you're not an Arlington County resident, we're happy to point you in the right direction of the VICAP program who can assist you. So our team consists of staff, and it's mostly driven by the support of our volunteers. We couldn't do it without them, and we do serve, again, Arlington County residents, but we also serve Arlington County colleagues and their neighbors, caregivers. We counsel a lot of caregivers, by the way, and care partners on all things related to Medicare, Medigap insurance, what's also known as supplemental coverage, Medicare Advantage, also known as Part C. We do a lot of counseling too around ways to lower Medicare costs, which could include maximizing Medicare savings programs, Medicaid issues. We talk about long-term care and other health insurance. We get a lot of, because this area is filled with a lot of folks who are still working, federal retirees. We have a lot of individuals who contact us to try to gain more information about the coordination of benefits. Due to COVID-19, we're providing a lot of assistance from a distance, but however, we are here today offering some in-person support as well. So our mission and our purpose is to be able to educate and empower Medicare beneficiaries so that they can understand how to navigate the health insurance landscape. We do provide a large amount of counseling to everyone. So that includes the underserved, the underinsured, the uninsured. We've also spent a lot of time making sure we're reaching all people groups. So individuals whose primary language is not English is also a top priority because we do retain a culture of being customer focused. So let's focus on Medicare 101, what it is, and then how people can benefit from the OEP season. So Medicare is a federal health insurance for people who are ages 65 years of age and older and who have worked for at least 10 years and paid 10 years of FICA taxes, which is also taken out through their employer. It's also for certain people who have disabilities that may be under the age of 65. The disability, of course, is deemed by Social Security Administration. And so a person must have received Social Security disability benefits for at least 24 months. There are special exceptions, which includes individuals who have been diagnosed with end-of-stage renal disease, which is also kidney disease or ALS. And to get Medicare, a person must be a US citizen or a permanent resident, legal resident who's lived in the United States for at least 5 continuous years. These are our great partners on the federal level. So there's Social Security Administration, and then also the Centers for Medicare and Medicaid Services. We do get a lot of questions about enrollment. Enrollment starts with SSA. So SSA is supposed to be sending out a welcome to Medicare packet for individuals who are eligible at least 3 months before they turn 65. SSA has been inundated though, as we have been informed. So if you haven't received a welcome to Medicare packet and you know you're eligible, please do reach out and contact them at the 1-800-772-1213 line, and they'd be more than happy to assist you. All right, let's focus on the 4 parts of Medicare. There's Part A for hospital insurance. There's Part B for medical insurance. There's Part C for Medicare Advantage coverage. I like to think of Part C as being bundled insurance. And then there's Part D for Medicare prescription drug coverage. Taking a bit of a deeper dive, here are the Medicare choices. There's original Medicare, which consists of Medicare Part A, B. You can also add D for prescription drug coverage. And then if you want to, you can add the supplemental coverage. Supplemental coverage in this instance is known as Medigap. And then on the other side, there's the Medicare Advantage coverage, which is also known as Part C as in cat. I like to think of this as bundled insurance. So it consists of Part A, B. You can add D. It doesn't necessarily, you don't necessarily have to if you have creditable coverage or you're on your spouse's coverage. And then it has extra benefits too that we'll talk a little bit more about. Now, there are some plans that include lower out-of-pocket costs. It just all depends. We do encourage people to take a deeper dive into the Medicare Part C or Medicare Advantage plans to kind of understand what the benefits are. And then, you know, if they, of course, work with your doctor's office. So let's talk about Part A, which is hospital insurance. So most people don't have to pay a premium for Medicare Part A if they've worked at least 40 quarters or paid FICA taxes for at least 10 years. However, if that is not the case, you can purchase Medicare Part A for a fee. So we do have some new numbers for 2023 that CMS has rolled out. In 2023, the Part A premium for a person who's worked less than 30 quarters of Medicare covered employment is going to be $506 per month. Those who've been between 30 to 39 quarters of coverage could also buy Part A at a reduced monthly premium rate of $278, which is also per month. So with Medicare, there are late enrollment penalties. The late enrollment penalties exist for the life of Medicare for those who may not know. And Part A helps to cover things that are medically necessary, like inpatient care in a hospital, inpatient care in a SNF or a skilled nursing facility, hospice care or home health care. Medicare Part B is also known as medical insurance. In 2023, the standard Part B premium is going to decrease to $164.90 a month. The premium ranges also depend on a person's income, or also known as a person's IRMA. We do have a chart that I'm going to send out on the back end. So for those who are joining us in person, please do make sure I have your email address that's on the sign-up sheet, because I'm going to send a follow-up email by the close of business today. The cost of Part B could increase for 10% for each 12-month period that you could have had Medicare Part B as in boy, but you didn't take it. And again, the late enrollment penalties for Medicare are for the life of the insurance. And so when it comes to Medicare Part B as in boy, it helps to cover medically necessary things like doctor services, outpatient medical, surgical services and supplies, clinical lab tests, DME or durable medical equipment. We get a lot of inquiries actually about DME for people who are looking for things like wheelchairs, walkers, canes, oxygen equipment, and things of that nature. Diabetic testing equipment and supplies, preventative services, home health care, and then medically necessary outpatient PT, OT, and speech language pathology. And then finally, it covers the outpatient mental health services. So there are times when Medicare Part A and B is absolutely necessary. And that, goes if you're wanting to purchase a Medigap policy, it's necessary. Then you want to enroll in an MA plan or Medicare Advantage plan. Parts A and B are also necessary at that time. If you're still eligible for TRICARE for Life, we do counsel some individuals who have been in the military. This is where that would come into play. And then if your employer requires you to have it and they have less than 20 employees, Part A and B would be necessary at that time. What's not covered by Medicare Part A and B? So that's original Medicare. Most dental care is not covered under original Medicare. Eye exams related to prescribing glasses, dentures, cosmetic surgery, and massage therapy. Some of these items are covered under Part C. Medicare Advantage plans, it just all depends. And even if they are, we do encourage people to contact the plans or contact us, and we'll contact the plans with you to do a bit of a deeper dive to see just how much support around these benefits the MA plans may offer. Routine physical exams, acupuncture, hearing aids, long-term care, and then concierge care. So there is a transition that we've seen. So there's a concierge care model that we wanted to just bring to light while we're on this topic. There are a lot of physicians who have been changing out of accepting new Medicare patients, and they're transitioning over to the concierge care model. There's more money involved, and we're finding that there are less doctors now that want to be involved with accepting Medicare or Medicaid for that matter. So the pool of physicians is shrinking, unfortunately, for doctors who are accepting new Medicare patients. Part C for Medicare Advantage, it's important to know a few things. Medicare Advantage is offered by Medicare approved private companies. There is a very long list of providers on the CMS website. If you go to cms.gov, you'll be able to download the spreadsheet that they have there if this is of interest to you, to find out what Medicare Advantage plans will be available for 2023. Most plans, again, can include Part D coverage, although they don't always. So if you don't have a prescription drug plan, we do ask you to please add it so that there's not a late enrollment penalty on the back end. And then if you join a Medicare Advantage plan, it's important to know that you'll have to use healthcare providers who participate in the plan's network. This is important because if you do not do that and then you end up going to a provider, they probably will send a bill on the back end of the appointment. Each plan has different rules, but the plans do change every year. Hospice care is covered, but it's covered under original Medicare. And then one good thing to note is that you need to have Medicare Part A and B as in boy to join into Part C. And then of course you must live in the plan's network. So the network of course is a zip code. If you go to medicare.gov, they will ask you some key questions, and before you can move forward, you'll have to put in your zip code to be able to yield the results and obtain the plan's information that you're seeking in that specific area. So when it comes to Medicare Advantage plans, you still get the same services that are covered by Part A and B, which is also original Medicare. There may be different out-of-pocket costs. It just all depends on the plan. There is information on the medicare.gov site that'll be able to show you that information. And then of course, you can always make an appointment with us if you're interested in doing so at 703-228-1725. Some of the MA plans have additional benefits like vision, transportation, fitness, or dental benefits. And then one important thing to note is that Medicare Advantage plans don't work with Medigap policies. When it comes to Part D for prescription drug coverage, it is important to know a couple of things. Part D is also run by private companies that contract with Medicare. And again, If you're interested, you can go to the cms.gov website to be able to pull down the Excel spreadsheet for that information. You can add Part D to Original Medicare. Part D usually includes, is included in MA plans, but not always. The price difference for 2023 is going to change and estimate between $5 up to $100 a month. And then the 2023 drug deductible is estimated to cost $550 a year. And thank you. You must have Part A and or B and then live in the plan's service area. The service area is the zip code. So when it comes to how Part D plans work, they're provided through Medicare prescription drug plans that work with Original Medicare or Medicare Advantage drug plans. There could be a lifetime penalty. It just all depends, but we do encourage people to enroll on time to avert the late enrollment penalty. And then if you have limited income, there are resources that can help you to reduce the cost of the penalty if there is one that has been assessed, or to get you out of the penalty. So Social Security Administration has something called extra help or low income subsidy to help you pay for the Medicare Part D costs. And for 2023, if you're able to enroll in an extra help program, or you get our help enrolling in an extra help program, it can help to reduce costs for prescription drug plans of up to $5,000 a year, which is great. So starting in January, there is going to be a $35 cap per month for prescriptions for Medicare Part D covered insulin, and then for insulin furnished through durable medical equipment under Medicare Part B as in boy. So Medigap policies are also called supplemental plans. And again, they work only with Original Medicare, not Medicare Advantage plans. Each company for Medigap policies decides how much it sells, the policies for. It also, we encourage people to enroll on time. So technically, if you're looking at a Medigap policy, you want to enroll the same time you're enrolling in Medicare. Once you start a Medigap policy, it cannot be repeated. And then for those, some of you may know this, but we just want to reiterate that, effective January 1st back in 2020, Medigap no longer covered the Part B deductible, B as in boy. Plan C and F, and then high deductible F, are also no longer available for new beneficiaries. However, if you already have these Medigap policies, you of course can maintain or retain them. It's just that the cost may, of course, increase because the pool of new folks is not available anymore. So what's new? I don't know if you all are aware of this, but there are Medigap policies that are now available to individuals that are under the age of 65. So this is great news as well. There's a tool on the State Corporations Commission's website. Jordan, if you can put that link in the chat for people to be able to assess. There is also one on the Medicare.gov website, but we found better results on the SCC's website. The Bureau of Insurance has a new Medigap tool that rolled out not too long ago if you're interested in assessing Medigap policies. There is new legislation, the Inflation Reduction Act, which is now law. HR 5376 is something that we wanted to highlight. The Senate is now allowing Medicare to negotiate prices of high-cost medications, including the caps on Part D, as in for prescription drug plans, and then on the cost of Medicare-covered insulin, to provide savings to Medicare and then also Medicare beneficiaries. So what are some of the highlights in the legislation? It's going to allow Medicare to negotiate drug prices and caps for out-of-pocket costs up to $2,000. It'll also limit Medicare beneficiaries' out-of-pocket spending on insulin products covered by Medicare Part D plans, going back to the $35 per month, which is great. We do counsel a lot of folks who are insulin dependent, and if you are in that category, you'll know that those costs can be extremely high. It also lowers the ACA healthcare premiums for millions of Americans, and then it expands the eligibility for full Medicare Part D. So the extra help program I was just talking about on the slide prior, the LIS program through SSA is going to expand. And then it will eliminate the partial LIS benefit. So for those who are interested and eligible, they'll be able to get full extra help, and there will no longer be a partial extra help benefit. Are there any questions online? I'd like to pause and see if, are there any questions in the room? There's a question about the Part D deductible for 2023, which is going to be $550. So if your drugs are significantly less than the deductible, sometimes, you know, it depends on the cost of the drugs that you're taking, and everybody's situation is different. Some people, you know, maybe have one, if any at all. And then some people we counsel have 20. So it just all depends on how many drugs you're taking, what the cost is of the drugs that you're taking. Some people exceed that cost. If you exceed the cost, of course, the deductible would kick in at that time. If you have one drug that you're taking for, you know, $20 a month, then it wouldn't be applicable. If you want to set up a counseling session so we can take a look at, you know, your current situation, we'd be happy to do that as well. Okay. And actually, after, I know there was some promotion going on. So after today's presentation, we do have 3 scheduled appointments. However, if there are some other folks here who are interested in counseling, you know, we have enough staff on our team to be able to accommodate that. So that's something you can think about as well. There's a question in the room for those online about what Medicare does and does not cover. So I said physical. So if you have original Medicare and you're wanting to go to the doctor, and there's actually a list, I don't have it with me. I can send it. Please make sure we have your email address. There's a laundry, actually, if you want to get the Medicare new book in the front of the room, I was going to say there's a list of preventative services in there that would probably be helpful to know. So, page 54. Thank you, Charlie. So there's a question in the room regarding enrollment in Medigap policies. So when you enroll in a Medigap policy, one of the things that I mentioned earlier is that you should enroll at the time of when you enroll in Medicare. Each year, due to inflation, and it also could be related to healthcare issues that a person may have, the cost of Medigap policies increase. So you could enroll later. You could do that, absolutely. But the longer you wait, just like the longer you wait to enroll in a long-term care insurance policy, the more cost effective it will not be for the beneficiary. So there's a question around enrollment and timing of enrollment. So there is a Medigap Open Enrollment. Medigap Open Enrollment is generally around the same time of the Medicare Open Enrollment. We highly encourage people to enroll on time when they are 65 years of age because of the issues that I just mentioned. So you could, the longer you wait, or if you decide to go back, you could be subjected to what's called medical underwriting, okay? And the longer that you wait, I mean, you can, you know, if you wanna wait until you're 80 or go back to it, that's fine. But the cost is always going to go back to you, right? And you're going to have to pay more out of pocket than you probably would have if you wouldn't have waited or delayed or something like that. So there's a question in the room about timing of enrolling in an original Medicare and then also a Medicare Advantage plan. So I don't know if you're working or anything like that, but when you enroll in Part A and B, if you do not have what's called creditable drug coverage through an employer, or sometimes we counsel people who have health insurance through their spouse, In those instances, you can also delay enrollment in C or D. C, Medicare Advantage plans, D, prescription drug coverage. If you do enroll, of course, you want to complete the appropriate paperwork to let SSA know that. However, if you don't have creditable coverage, we do encourage you to enroll at the same time, because that's where the late enrollment penalties come into play. So even if you're not taking any prescriptions, and some people don't, when you go back to enroll in Medicare Part D or Part C at a later time with drug coverage, they may say, okay, well, you didn't enroll on time, regardless of whether you're taking prescriptions or not. Hence, that's where the late enrollment penalty comes into play. The gentleman in the room brought up some great points. Yordi, our colleague, is going to put some information in the chat about a resource that our participant brought up, which is the Kaiser Family Foundation, which has a wealth of information and knowledge that our team refers to often. If you're wanting to check that out, he also brought up some great tips about the concerns around the inundation of mail ads and all those kinds of things from brokers, advertising Medicare Advantage plans. We do want to reiterate that, brokers do get kickbacks for enrolling people. Sometimes it's thousands of dollars. And so you do have options of whether you want to take that direction or not. If you do decide to go in that direction, we do encourage people to please check in with your doctors first to make sure your doctors are in the network. And then, of course, make sure the plans cover your prescription drugs, because we've seen people enroll in those plans because of some of the benefits that they offer, and then get bills on the back end of doing that because they didn't do their homework. So let's move forward with the slide deck, and then at the end, we'll open it back up again for questions. And then at the end, I want to make sure we're addressing anyone that's in the virtual space. Right now is the Medicare Open Enrollment period, which started October 15th, and it also ends December the 7th. So we are midway. I want to thank our team again for doing a phenomenal job during the Medicare Open Enrollment period, because our numbers have doubled since the beginning of October. It's a 7-week period where people can enroll and disenroll or switch to either the Part C or Part D, as in David plans. It's also a great time to be able to review health and drug plans. There are some people here in the room that we've already helped, and we've helped them save thousands of dollars by reviewing and assessing their prescription drug costs. So the program is valuable. I thank everyone for patronizing our program and continuing to remember that we're here to assist the community. So if people make changes during the Medicare Open Enrollment period, the coverage changes will begin in January of 2023. There are a couple ways to do it. There's a Medicare Planfinder tool, which we're going to demo in a couple slides down. And then, of course, you can use the support of our team. So you can contact us at 703-228-1725. It's important to do that because plans change coverage each year, to the gentleman's point in the room. It's important to take a look at that. Each plan is, for the Medicare Part C and D plans that are contracted through CMS, they have different rules and things that they cover. And again, if you want to download the spreadsheets on CMS.gov's website, you're more than able to do that. So switching gears and taking a deeper dive into the Medicare Planfinder. And then a couple slides down, we're going to do a demo and show a video of what the process looks like. The Medicare.gov Planfinder is a tool that you can use to shop for and compare the Medicare Part C plans, the Medicare Part D as in David plans, and then the Medigap policies that we talked about. This is a small screenshot of what it looks like when you first go to the Medicare.gov page. It's going to ask you your zip code. Remember earlier, there was a question around like networks and where the plans are. So if you type in the network or your zip code, which is, here in this photo, We generally use our office zip code when we're counseling, which is 22204. The next drop down, you'll be able to choose, are you looking for a Part C plan, a Part D plan, so on and so forth. And then you would click the green button there that says next. This is where your prescription drug lists come into play. And again, sometimes, individuals have 1, 5, 10, 20. It just all depends. Having a Medicare.gov account is wonderful in the sense of that if you have prescriptions that you're entering in, you can always go back to the Medicare.gov site and be able to automatically yield that information. If we put in your prescriptions, we don't have an account for you. When we go back to it, we would have to just do that all over again. Here's a screenshot of how you can find and compare, just for example, hypothetically speaking, Medicare Advantage plans. Thanks. Here are 3 types of plans that you can take a look at. And again, this is all hypothetical. We do like to look at things like the star ratings. And then for folks who are interested in Part C plans, you can take a look at specifically what benefits each plan has to offer. Just because the plans offer these benefits does not necessarily mean a person is eligible to receive them, okay? There are some chronic illnesses that sometimes people have to have. The Medicare Advantage brokers do take a look at that, and they do want to obtain additional information. So again, just because a plan offers these benefits does not necessarily mean a person is automatically eligible to receive them. Here's a screenshot of a Part D prescription drug comparison list that we pulled from the Medicare Planfinder. Again, these are the names of the drugs, the costs of the monthly premiums, the star ratings, the cost of the deductibles. You also want to make sure you're taking a look at the pharmacies. You can compare and choose up to 5 pharmacies. We do encourage people to take a look at making sure they're selecting the pharmacies that say preferred, not in network, not out of network. If you choose a pharmacy that's preferred, you'll get a better cost and price point for your medications and prescriptions. So here's a list of what the page looks like. If you're making a comparison, you can choose again up to 5 pharmacies based on the zip code in your area. And then Nick, here we go to the demo that we like to show for the Medicare Planfinder tool.
At Medicare.gov, it's easy to find and compare plans in your area, see your options, and join a plan that covers what you need at a price you can afford. See your estimated costs based on the drugs you take and pharmacies you choose to help you compare plans. And your online Medicare account makes it faster to save and update your drug list and compare plans at any time. Let's get started. First, visit medicare.gov/plan-compare. Select Login or Create Account for an easier, more personalized experience. Or select Continue without logging in to find plans as a guest. Not sure which Medicare health and drug coverage is right for you? Select Learn More about options. We'll log in. If you log in or create an account, you can quickly add drugs and save your drug list and favorite pharmacies to easily compare plans later. Enter your username and password. If you have Medicare but don't yet have an account, select Create an Account Now. After you log into your online Medicare account, you'll see your name and current plan. If you switch plans during open enrollment, October 15th through December 7th, we'll show you the new plan you requested to join if you submitted an application. If you didn't make a change, you'll see your current plan, which you'll keep for next year if it's available. If you get extra help paying drug costs, you'll also see that amount. Start by choosing the type of plan you're interested in. You can choose a Medicare Advantage plan, a standalone drug plan, or a standalone drug plan plus a Medicare supplement insurance policy called Medigap. If you're not sure where to start, you can select I want to learn more about Medicare options before I see plans. Let's choose Medicare Advantage here. Since we're logged in, our information is already filled out for us. Make sure the information is correct, then select Next. If you're not logged in, enter your zip code and select Continue. Be sure to scroll down to select your county. We'll ask you if you get help with your costs from programs like Medicaid or Extra Help. Once you answer this question, scroll down and select Next. We'll then ask you if you want to see drug costs when comparing plans. Checking yes to seeing drug costs can help you get a better idea of what your costs would be in each plan based on your current prescriptions. Then select Next. Now, let's update a saved drug list. If you're logged in and you saved a drug list before, you'll see your saved drug list. If you don't see all the drugs you take regularly, select Add Recently Filled Drugs to see all the prescriptions you filled in the last 12 months. Check the boxes for each drug you take regularly. If you take all the drugs shown, just check the top box to select all the drugs. Then select Next. If you check a box by accident, it's fine. Just click it again to uncheck it. We'll add one of the drugs on the list, Nexium. You'll return to your saved drug list. Confirm that the drugs listed are the ones you're currently taking regularly. Don't list drugs you take temporarily, like an antibiotic. This will help you better estimate your regular drug costs and help you find the lowest cost plan. Don't see a drug you take on a regular basis on your list? Select Add Another Drug to add it manually. Enter the drug name and select Add Drug. We'll add Lantus, a type of insulin. If available, it'll ask you if you want to switch to a generic drug or keep the brand name drug you entered. Generally, generic drugs lower your costs, but make sure you add the name of the drug your doctor prescribed. You'll then add the dosage, the quantity you take, and how often you refill the prescription, like 30 pills every month, which is 1 pill per day. For some drugs, you'll add how it comes packaged. Check your prescription package for this information or contact your doctor or pharmacy. The information is added for Lantus, so we'll select Add to My Drug List. After you add a drug, you'll return to your drug list and see that it's been added. If the list has drugs you no longer take, or there's a drug listed that you don't recognize, you can remove the drug. If the dosage, quantity, or frequency of a drug you still take has changed, you can edit it. We'll edit Nexium and change the dosage to 20 milligrams and quantity to 15 pills each month, which is about 1 pill every other day. Then select Update this drug. This will update the drug on your saved list. Once the list shows all the drugs you take with the correct dosage, quantity, and frequency, select Done Adding Drugs. Let's look for pharmacies. If you're logged in and have already saved the pharmacy list, you'll see that here. Check to make sure the pharmacies listed are ones you would use to fill your prescriptions. If you no longer use a pharmacy, select Remove Pharmacy to take it off your list. If you don't see a pharmacy you would use, select Add Another Pharmacy. You can choose up to 5 pharmacies where you would fill your prescriptions. Drug costs can vary in each plan based on the pharmacy you use. Picking different pharmacies lets you see how plans work with those pharmacies and which would have the lowest costs. You'll be able to see the costs of your drugs at each pharmacy in Plan Details later in your search. Pick pharmacies you use now or choose other pharmacies in your area to see if one may offer lower costs. To find pharmacies in your area, you can enter a specific pharmacy name, search by zip code, or search by your address to find the closest pharmacy if there are a lot in your area. Then select Find Pharmacies. You can use the distance filter to show more or fewer pharmacies and see the ones that are closest to you. You can also use the map on the right to see their locations. Mail order pharmacy is listed first. Every plan with drug coverage offers mail order. It's usually a lower cost option, but not always, so it's a good idea to look at some other pharmacies too. If you select mail order, you can pick up to 4 other pharmacies. Choose the pharmacies you want by checking the Add Pharmacy box. As you choose pharmacies, they also appear in the blue bar at the bottom of the screen. To remove a pharmacy you don't want, select the X for the pharmacy in the blue bar or uncheck the box next to the pharmacy name on the list. When you're done picking pharmacies, select Done on the far right side of the blue bar. We'll pick Mail Order and 4 pharmacies. Next, let's learn how to filter plans. You'll now get the results from your plan search. During Medicare Open Enrollment, the first plan listed is usually your current plan for next year, unless you join a different plan. It's a good idea to look at your plan's benefits for next year to see what's changed and if your current plan will still meet your needs. When you're done, you can minimize that window by selecting Your Next Plan. If you want to see it again, just select Your Next Plan again. Use the filters above to see plans that only include benefits you want. For example, if you only want to see plans that include both vision and dental, select those choices from the Plan Benefits filter. If you only want to see plans with drug coverage, select that in the Drug Coverage filter. The other filters allow you to see only certain types of plans, plans with a certain Medicare star rating, or plans offered by a certain insurance carrier. We'll pick vision, dental, and includes drug coverage. Plans are sorted automatically by the lowest drug plus premium cost, but you can sort in other ways too. Let's take a look at one plan's information. As you view a plan, you'll see many important things to consider. You'll see its overall star rating between 1 and 5 stars. You'll also see some of the different costs and benefits it offers, and whether it includes drug coverage. Looking a little closer at the costs, you'll see the plan's monthly premium. Since we're looking at Medicare Advantage and other health plans, the information reminds you that you need to keep your Part B coverage to join and stay in the plan once your plan coverage starts. Remember, you'll have to pay your Part B monthly premium in addition to the plan's premium. You'll see your estimated yearly drug plus premium costs since this plan includes drug coverage. This amount is an estimate of the costs to fill the drugs you entered at the pharmacies you chose, plus your monthly premiums. But it doesn't include any estimated health costs like copays or deductibles. If you're looking for a plan for next year during Medicare's open enrollment, this cost will provide an estimate of the amount you may pay for your premiums and drugs for the entire year. But if you're looking at plans in the middle of the year, this will include costs for the rest of the months left in the year. For example, if you're looking at plans in May, it will include the costs for June through December. Remember, this estimate doesn't include other costs for health services. You'll also see other costs like the maximum amounts and copays you pay for health services. To learn more about what each of these items are, select the underlined text to open a window with more information. To get more details about a plan, its costs, and what's covered, select Plan Details. The blue bar at the top shows you a couple of important costs like the monthly premium, health deductible, your primary doctor copay, and your estimated total drug costs. Scroll down or select Overview to see more important cost information. Continue scrolling or select Benefits and Costs to see what your costs and coverage would be for things like doctor's visits, tests, hospital services, and more. Next, you'll find drug coverage. This shows you if the pharmacies you chose are out-of-network, standard in-network, or preferred in-network. Generally, costs are lower if you use an in-network pharmacy. If a pharmacy you chose is out-of-network, select Find an in-network pharmacy to switch to an in-network pharmacy in your area. You can even filter these pharmacies if you only want to find preferred in-network pharmacies, which usually offer the lowest cost for drugs. Once you're done adding pharmacies, select Done. As you scroll down, you'll also see detailed information about the costs for each drug you take at each pharmacy you chose. If the plan doesn't cover a drug you take, it will display the full retail cost across all the columns. If the plan doesn't cover a drug you take, you can look at other plans or consider asking your doctor whether you can take a generic drug instead of the brand name drug to help lower your costs. Then you'll see your total yearly drug plus premium cost when you fill your prescriptions at each of your pharmacies, and you'll see when you'll meet your yearly deductible. Generally, you'll want to look at your estimated monthly drug costs to see your costs broken down for each month of the year. As you scroll down, you'll also see things like any extra benefits the plan offers. If there are any optional packages you can buy in addition to the plan, and the plan's star ratings. When you're done looking at plan details, scroll to the top of the page and select Back to Search Results. You'll come back to your search results, and at the top, you'll see your current plan again. You can minimize it again by selecting Your Next Plan. Let's learn how to compare up to 3 plans. You can select up to 3 plans to compare at one time. To select plans to compare, check the Add to Compare box. You'll then see it in the blue bar at the bottom of your screen. If you're currently in a plan, it will be automatically included in the blue bar. You can keep it to compare, or you can remove it and compare a different plan. Once you've added all the plans you want to compare, select Compare on the right end of the blue bar. We'll pick 3 plans to compare. Now you see all of the plans you chose side by side, along with the total monthly plan premium. First, you'll see an overview of each plan, like its star rating and basic cost information, like premium and deductibles. Then scroll down to see more information about each plan, like benefits and costs, whether the plan covers extra benefits, and a quick view of your estimated drug plus premium cost for each pharmacy you chose. When you find a plan you're interested in, scroll to the top or bottom of the page and select Plan Details for more information, or return to your search results by selecting Back to Plan Results in the left of the screen. When you find the plan you want to join, select Enroll. A pop-up window will start your application to join the plan. After you complete your application, you'll get a confirmation number. You can also contact the plan directly to join. To get the plan's contact information, select Plan Details. The plan's contact information is at the end of the overview section of the Plan Details page. Once you submit your application to join a plan, you'll hear from the plan after they verify your information and confirm your enrollment. If you have a Medicare account, it takes at least 10 days for your new plan to show in your account. If you have any questions about your new plan, you should contact the plan directly. When you're done using your account, be sure to log out and close the browser window to help keep your information secure. Need more help picking a plan? Call 1-800-MEDICARE, 1-800-633-4227.
Okay, thank you for joining us with the demo. That's the process that our team follows when we are working with individuals to assess and or enroll them in a Part D or Part C Medicare Advantage plan during the Medicare Open Enrollment period. There are some new Planfinder features that we wanted to make you aware of. So the larger, more prominent display which is something that you saw in the video, which is also new. That's something that CMS has rolled out. There's a discontinuation of MyMedicare.gov accounts, so it's just Medicare.gov. There is a removal of the insulin senior savings model for those who may have noticed, and then the in-network pharmacy finder feature that you can locate in Medicare.gov. Here are some resources as we are closing out the presentation. Again, I'm going to share the presentation and some resources with all participants. So please do make sure for the folks in the room that your email address, we have access to your email address so that I can include you in that. And then of course, our upcoming programming. If you have any questions for those online, thank you for joining us today. You can give us a call at 703-228-1725 or send us an email at medicarehelp@arlingtonva.us. Again, our team focuses on counseling Arlington County beneficiaries, including caregivers, neighbors, colleagues, etc. If you reside outside of Arlington County, we're happy to point you in the direction of where you can reach your local state health insurance and assistance program.